Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today we've got a practice question. This is related to the metabolic and endocrine system, so certainly into the other systems section on the NPTE. But before we get to that, just a quick reminder, if you haven't yet, be sure to check out ptfinalexam.com/podcast to sign up for all the tips, the tricks, the cheat sheets, all the content you need to dominate exam day, all the freebies we've got to give away. You can find all of that at ptfinalexam.com/podcast for more information there. Plus, if you are involved in your cohort in any way, be sure to check out our cohort programs with PT Final Exam. So we've got everything ranging from online only content, we can run custom courses, and really we can get your whole cohort through the crash course. We can come on campus. We've got written material, we've got practice exams. Currently we've got 6 of those. We've got tons and tons and tons of content available to you, all at university cohort pricing. So whatever you use for your NPT prep as a part of your cohort, be sure to check out ptfinalexam.com, where we can give you more information and how you can enroll your entire cohort for a pretty sweet deal. All right, so let's go ahead and talk about the metabolic and endocrine system. So this question I've got for you is related to metabolic and endocrine interventions. So on the exam, as you recall, the metabolic and endocrine system only has a handful of questions, somewhere between 5 and 7 questions, primarily related to differential diagnosis and interventions, meaning can you identify the symptoms, the signs and symptoms related to a metabolic and endocrine issue? Also, do you know what some of the results or the adverse effects or the desired effects of interventions would be on the metabolic and endocrine systems? So often we talk about diabetes as one of the primary diagnoses you've got to know for this category. And we've had other questions about that. Today we've got a question that is not necessarily related to diabetes. So without further ado, let's go ahead and dive into our question. I will read it to you, give you a moment to respond, and then we'll talk about it together. All right, so this patient, we've got a patient with chronic low back pain that has been receiving oral dexamethasone, Decadron, for 5 years. The patient is scheduled to receive a total knee arthroplasty in the short-term future. Which of the following negative effects which of the following negative effects is the patient most likely to experience as a result of the dexamethasone, Decadron? So again, a patient with chronic low back pain has been receiving oral dexamethasone, Decadron, for 5 years. The patient is scheduled to receive total knee arthroplasty in the short-term future. Which of the following negative effects is the patient most likely to experience as a result of the dexamethasone, Decadron? So number 1, anorexia, nausea, vomiting. 2, hypotension. 3, increased inflammatory response. And 4, poor wound healing. So we've got anorexia, nausea, vomiting, hypotension, increased inflammatory response, and poor wound healing. So this is a bit of a combo. In fact, this may fit even better into the system interactions as you consider what the long-term effect of Decadron or dexamethasone, a corticosteroid, so as a medication or a medically administered corticosteroid, what are the effects, or in this case, the negative or adverse effects that this patient is likely to experience, especially in relation to that total knee arthroplasty? Well, the biggest one that they're going to see is that poor wound healing. So poor wound healing, this is one of the long-term effects, or the effects, I should say, of long-term corticosteroid use. So consider this for a moment, that corticosteroids creates a catabolic effect on proteins. It tends to break apart proteins. By so doing, it has some significant effects on connective tissue and skin. Really, the end result, though, is that you have very poor wound healing simply because your body can't stitch things back together very well. And in fact, that's why you typically see the cushiony, very moon face presentation, the protuberant abdomen, the buffalo hump on the back. All of those are catabolic protein, or I guess catabolic destruction of proteins that are then replaced by fatty deposits, all that leading to a very, as I like to think, a very cushiony appearance. And so that's the correlation I make between Cushing's disease and a cushiony appearance of that, as you call the moon face, the buffalo hump, protuberant abdomen. These folks also tend to have significant muscle wasting, a lot of catabolic tissue breakdown, poor wound healing, just to name a few. But in this particular case, that long-term dexamethasone use is going to result in poor wound healing for this individual, especially considering that total knee arthroplasty coming down the road. Now, as far as the inflammatory response, typically corticosteroids are used as an anti-inflammatory, so it's not likely that you'll see an increase in inflammatory response. And then the anorexia, nausea, vomiting, and hypotension, those are all signs of hypocortisolism, or Addison's disease, where you have too little cortisol or corticosteroids in the blood. And in this case, we have way too many of them, so that oral dexamethasone for 5 years, that is likely to result in the long-term Cushing's syndrome, because you have essentially way too much cortisol or corticosteroids flowing through the system. So again, the correlation I make between hypercortisolism is that you have Cushing's syndrome. And again, anytime you see the word syndrome just indicates you have a grouping of symptoms that are loosely related or aggregated. So Cushing's syndrome, we have the moon face appearance, you have the protuberant abdomen, buffalo hump, you get hypertension, decreased bone mineral density, poor wound healing, poor connective tissue. There's a lot of sequelae related to Cushing's syndrome. And in this case, poor wound healing would be at the forefront, considering that the patient is scheduled to receive a total knee arthroplasty. Now, the question you should have in your mind now is, why in the world would this patient be on long-term corticosteroids? Well, corticosteroids are often used for long-term inflammatory conditions. So not the least of which would be things like rheumatoid arthritis, systemic lupus erythematosus. The patient I had in recent memory was a patient with chronic low back pain that was receiving prednisone or dexamethasone, really just any derivative of the corticosteroids, receiving that long-term, and they developed the Cushing syndrome. So again, any type of long-term inflammatory response, and some of it musculoskeletal, but a lot of it systemic, such as systemic lupus erythematosus and rheumatoid arthritis, just to name a couple, that those are the folks that are likely to be on long-term anti-inflammatory medicines, such as dexamethasone or prednisone, or any number of the corticosteroids. They tend to end in SONE, like dexamethasone, prednisone. They usually end in that suffix. Anyway, the bottom line for this patient, though, is poor wound healing. And so that would be, again, a great system interactions question, talking about the integumentary system's healing effects, or the potential for integumentary system healing, and the use of long-term corticosteroids. So again, you can see how that could be crafted into a number of questions, like someone with systemic lupus erythematosus, what would be the effect on integumentary healing, something like that. You can see how that could be easily crafted into a question. All right, so that'll do it for today. If you haven't yet, be sure to check out all the other episodes we've got on the NPTE podcast. Also, if you haven't yet, be sure to leave us a 5-star review. It really helps as we get the word out about the NPTE podcast. And in the meantime, stay safe, happy studying, and I'll catch you all in the next episode. Will Crane fist pumps all around.